Hello, my name is Sherry Cornell, and the topic I chose was psoriasis. These are my index cards. The reason why I chose psoriasis is because some people don't know what psoriasis is. And psoriasis is actually a skin disease that is caused by the immune system. People with psoriasis have an overactive immune system, which means that instead of our immune system fighting diseases or infections, is also fighting the skin cells that we reproduce, which means that this makes the skin cells reproduce a little bit more quickly, and it usually takes about a week or two for the skin cells to go through our body. But now with patients with psoriasis, their skin cells go through their body in like a couple of days. So that's really big. It grows really rapidly. So this means that the skin cells have nowhere to go. So they start rising on the surface of the skin, creating patches in red, white, flaky ways. There are 5 types of psoriasis, which is plaque psoriasis, goutte psoriasis, inverse psoriasis, pustular psoriasis, and erythrodermic psoriasis. Plaque psoriasis is actually the most common psoriasis. About 80% of patients with psoriasis develop plaque psoriasis. And this appears as red, white patches anywhere in the body. Anywhere from your arms, your legs, your hands, your back, your stomach, anywhere in the body you could get plaque psoriasis. And plaque psoriasis can cover from 1 to 90% of your body. And this 1 to 3% of the body is considered mild psoriasis. 3 to 10% is considered moderate psoriasis. And anything above 10% is considered severe psoriasis. So it's really important to treat psoriasis. Goutte psoriasis is usually triggered by infection. And it mostly appears on the upper part of the body. Doesn't mean that you can't get it anywhere else. It's just more common to get it on the upper part of the body. And this comes as little small red spots, and they're very itchy and flaky as well. Now, pustular psoriasis is an uncommon psoriasis. It usually appears on random areas of the body. And this kind of psoriasis develops blisters. And they will dry up, but then they will come right back. It's a little harder to treat pustular psoriasis. Inverse psoriasis is actually more common on overweight people. This type of psoriasis is developed on skin folds or armpits or under the breast. This type of psoriasis does not develop that scaly patch that the rest do, because this one actually appears on more moist areas. Simply the reason why it doesn't create that dry flakiness that the other psoriasis does is because this one is created in moist areas, or it appears in moist areas. Erythrodermic psoriasis is also a rare one, but it cannot be left untreated, because this type of psoriasis is created in inflammation or severe itching in the skin, and it appears to be as burn. So when you see it, it could be a little disturbing to see erythrodermic psoriasis. Psoriasis can also cause joint pains. This is called PSA, psoriasis plus joint pains. And about 30% of patients that have psoriasis develop joint pain psoriasis in their later on in their lives. They can notice that they're developing joint pains because they have swollen fingers or toes, and as well as tender joints. And it could also lead on to becoming psoriasis arthritis, which is also very common in patients that have psoriasis. According to psoriasis.com, things that can trigger psoriasis can be anything from stress or injury to the skin, such as tattoos, scrapes, sunburns, bug bites, or an infection. Or trauma, also like tooth loss or anything like that. A trauma to the body can also cause psoriasis and a psoriasis outbreak. If the patient is a smoker, it could also enhance the psoriasis to come out a little more or spread faster through the body, as well as consuming a lot of alcohol or changes in weather can cause your body to come with an outbreak. Psoriasis is really serious if left untreated. That's why it's really, dermatologists can't stress it enough, as you need to follow a treatment with a dermatologist to treat your psoriasis. Due to that, psoriasis is a chronic disease, which means it will come back. It needs to be specifically supervised by a dermatologist. Some of the treatments that dermatologists use are topical, which are cream, spray, ointments. And this is to treat the surface of the body, such as phototherapy, or also known as light therapy. And this is also to treat the surface of the body. Systemics is also another treatment that dermatologists use. And this is when they give you pills or an injection to treat the inside of the body. Although psoriasis is not a deadly disease or it could kill you, it's a huge mental factor in patients with psoriasis because it isn't common on most people. Psoriasis is not common, so people that don't have it may look at them differently. They might avoid salons or barbershops just to not be seen. In an article by Courtney Hargan on Everyday Health, she stated that about 50% of patients with psoriasis develop a depression or suffer from depression because patients stated that this disease have affected their emotional well-being. The depression can also interfere with their treatment. She stated that